All right, case number 1, 32-year-old man with buttock and hip pain. Here's the initial CT with IV contrast, and you can see there is a destructive lesion, pretty much destroying almost all of the L3 vertebral body, and it has some extension outside the vertebral body. Here's the MRI, sagittal T2 and sagittal T1 post-contrast with fat satin images. Again, shows that the abnormality, the lesion, pretty much involves all the L3 vertebral body with extraosseous extension. So is this an aggressive lesion or a non-aggressive lesion? First decision, as always, is the most important because that'll tell us which decision tree to use for the rest of this talk.
Thanks, Mike, for that explanation. You're now going to want to choose whether you believe this is an aggressive or non-aggressive lesion. You can find the links to the subsequent videos in the comments below.